Yes, it started recording.
Thank you. All right, well, then I'll go ahead and get started, everyone. Welcome again to PEAKPro training for the case management agencies. My name's Becky McKinney, and I will be your presenter today. I also am lucky enough to have a great group of subject matter experts to help answer any questions that you all may have as I go through the presentation. Speaking of questions, though, once I start the presentations, we will be disabling the Q&A part, the Q&A option. When I pause for questions, at that time, we will give the opportunity for you all to type questions in the Q&A or perhaps unmute you so you can ask your question without typing it in. The reason we're doing that is a lot of times we're going to get to the question that you have as I go through the presentation. And we don't want you focused on looking at the Q&As and then perhaps missing some important information that I'm covering as I go through the presentation. So that's what we're doing that. We want to make sure you get your questions submitted and that we get them answered. If we are unable to answer any questions that you have, we will take them back, get answers from the appropriate folks, and then add them to our already existing FAQ document. The way today is going to work is I will go through a PowerPoint presentation, kind of give you an overview of what we're doing, why we have today's training, what PEAKPro is, how you'll be using it, all of that good stuff. And then we're going to go show you some screenshots, and then we're actually going to log into PEAKPro, and I will show you the windows that you will be using immediately in PEAKPro, and then the window that you'll be starting to use effective July 1. This webinar, it's one of 3. This is our final one, and it is being recorded. So once we decide which recording is best, going to suit the needs of all of you, we will post that recording along with the PowerPoint presentation I'm going through. The PowerPoint presentation also contains a lot of good links to resources that you'll be able to refer back to once you actually get in and start using PEAKPro. So once that's posted, it'll post it on the LTSS training page, so you'll be able to access that information. So we won't be sharing anything immediately today, but you will have access to those materials here shortly once we get them all posted. I think that is all of the. Oh, I do want to let you know that as I go through the PowerPoint and when I log into PEAKPro, I am entering Social Security numbers, date of births, and names. But I do want to clarify to all of you that information is masked, and it could not be correlated back to any member or client that is known to CBMS. With that, I'm going to go ahead and jump in and start PowerPoint. Also, could one of you go ahead and disable the Q&A for me, please, Aiden or Amanda or somebody? Thank you. So PEAKPro training for case management agencies. So the purpose of this training was to talk about the functionality of PEAKPro and how you all at the case management agencies will be using it. So after today's training, you'll be able to explain the purpose of PEAKPro, understand what you'll be able to do and see in PEAKPro, and then we'll also walk through the steps that you'll need to do to request access to PEAKPro, and also the process for submitting help desk tickets for any PEAKPro issues you may have. Before we jump into what PEAKPro is, let's touch base on what PEAK is. So you may or may not be familiar with what PEAK is. PEAK stands for Program Eligibility and Application Kit, and it is actually a member-facing application that members or applicants can use to apply for and manage their benefits, their public assistance benefits. So if an individual would like to, if they're already receiving benefits, they can go to our PEAK website and create an account. And then once they log in, then all of their medical assistance, even food assistance, cash, all of that is then going to be housed in their PEAK account. Even if someone doesn't already have a case, but they want to use PEAK, they can go to PEAK, they can create an account, and then they have the opportunity to apply for benefits, and then go ahead, their application will be processed. Once they actually have their cases in there, they'll be able to do many, many things through their PEAK account. Now, we have heard that some counties say, oh, no, don't use PEAK. We don't like PEAK. We don't trust PEAK. You got to be very, very careful with that, because PEAK is one of the avenues that individuals have to apply for benefits. And we have to make sure that we are leaving all avenues that they would need or per se use to apply for benefits. We have to make sure we're leaving all of those opportunities and options available for them. So we always want to say, if you want to apply through PEAK, or PEAK is an option, and we don't want to discourage them from using an opportunity or an option like PEAK. Once you have this PowerPoint, there is a PEAK brochure that explains a little bit more in detail what PEAK is. These are the account thing. These are the things that individual can do if they have a PEAK account. So they can log into their PEAK account. There's a dashboard that shows all of the assistance, all the benefits that they're receiving. It shows effective begin dates, effective end dates of their benefits. They can view correspondence. So they can go in and say, I don't want to receive any more correspondence in the mail. I want all my correspondence through PEAK, or they can do both. They can also say, I want to view my correspondence in PEAK, and I also want to know when I'm getting when I have a piece of correspondence ready for me. So I'm not going to be in my PEAK account every day, but please send me a text or an email letting me know that I have a piece of correspondence available. Then I can go in and look at it, because some of the correspondence, like a verification checklist, can be time sensitive. So that lets them see it right away in PEAK versus waiting until they get it in the mail. They can, if they're on one of our buy-in programs, they can pay their buy-in premiums there. They can complete and submit their yearly redeterminations. They can upload documents. So say they're reporting a change, that maybe they moved or had a child, got married, changed jobs, whatever it may be. They can upload any documents through there. They can also, once again, along with that, they can report changes. They can go in and say, oh, do you need a check stub? Do you need additional information? They can need any needed verifications. And they can also go in and view and print their Medicaid ID cards. So that is PEAK. So PEAK is member facing, that is specific to the member. I'm going to go back one. PEAK is specific to the member. They're going to create their account. They're going to have a username and password. Only that member and any perhaps other family members or anything that they give access to can see their PEAK, their information in PEAK. You all will not be able to see anything in their PEAK account. The way you're going to view their information is through PEAKPro. So PEAK is for our member facing, our client facing side. And PEAKPro is for assisters. So it's the assister facing side. So PEAKPro is currently being used by a couple of other entities. It's being used by Department of Corrections And it's also being used right now for behavioral health services to get individuals on behavioral health services. PEAKPro is used for many different reasons. You all are going to be using PEAKPro to share information, and it's going to automate processes that are currently manual and paper-based between you all, the case management agencies, and the eligibility sites. So you all have a lot going on, right? The care and case management system came in, and then your streamlined implementation happened on February 17th. So kind of break it down. So your streamlined implementation has happened. PEAKPro will go live as of March 1st. And there are some PEAKPro functionalities that you'll be using effective March 1st. And the rest of the PEAKPro functionalities will go into effect for you all on July 1st. Please continue the current referral process, and I'll get into that here, just I'll kind of explain what that means. Referral process through July 30th of 2024. So how is PEAKPro going to come into play for all of you? So PEAKPro is essentially going to expand the long-term care Medicaid systems, how it communicates and transmits information with each other. So you all are already familiar with the interfaces that connect the CCM, the interchange, and the bridge. So what PEAKPro is going to do is it's going to kind of add this extra little connection between the CCM, then it's going to go to PEAKPro, and then it's going to go to CBMS. So as we know, CBMS holds the eligibility information, and PEAKPro then is going to communicate with, and it's going to go from CBMS, PEAKPro, from the interchange to the bridge. So it's going to kind of do that gap that you kind of had where you did not have PEAKPro, and some of your processes were manual to get it from CCM to CBMS. So you're learned a little bit about what PEAKPro is. What are you going to use PEAKPro for? So in effective July 1, you'll have the ability to receive assessment referrals from members. Either if it came from the member, it would have come through PEAK. So if they were in PEAK and they say, yes, I need assistance with those daily living activities, then it will trigger that referral, or if it came from the CBMS eligibility worker, but that will not be until July 1. What you'll be able to do now is you will be able to have the ability to search for any member that is known to CBMS and retrieve their current eligibility data. On the ongoing side, the case management agency, you'll have the ability to search for any member that is known to CBMS and retrieve their current eligibility data. So you'll be able to see what programs they're on, their contact information, who their caseworker is, all that great stuff. You will also have the ability on the ongoing side to view the current processing status for the long-term care level of care certification that you entered into CCM, and then it went to PEAKPro, and then it went to CBMS for processing. With the implementation of streamlined eligibility, so what is changing? So once again, all these things have changed and come into play. So let's kind of talk about what's changed and what you'll be seeing. So with the implementation of the streamlined eligibility that has already happened, you will no longer send the case management agency an eligibility information sharing form, or the DSS-1, and the LTSS certification pages to the county eligibility site. With the implementation of streamlined eligibility, this information is automatically communicated through systems. So that is happening currently now. The CMA and eligibility information sharing form should only be used for communication regarding cases completed prior to February 19th, communication if the system interface is not functioning, or other communication when needed. For example, referrals, because the referral functionality will not you will not be using that functionality in PEAKPro until July 1. So I know so streamlined eligibility is in play. If you have questions about streamlined eligibility or concerns, that is nothing we will be able to answer today. That's nothing we're covering today. If you have streamlined eligibility questions, those will need to be brought up at the streamlined eligibility office hours. So what's changing with PEAKPro? With the implementation of PEAKPro, you'll be able to check member eligibility and check the processing status of the long-term care level of care certification, and then eventually receive referrals either from PEAK or from CBMS for the LTSS programs, effective July 1. All right, I think this is kind of where we paused on the other day to pause for questions. So I'm going to stop sharing real quick before I go into PEAKPro Access and pause for questions.
Have questions activated.
Thank you, Amanda.
We do have a hand up, Allie. Oh, allow to talk now.
Can you hear me? Okay. I just had a quick question. So will everything need to batch overnight before like PEAKPro sends information to the CCM, or like, I guess I'm not quite sure how that works.
Allie, this is Carly Altman from the department. Can you say that question one more time for me?
Yeah, I'm just wondering, like in the system, so currently everything is having to batch overnight between systems to speak to each other. Is that kind of the same thing here? Are we going to expect it to batch overnight for most accurate information, or?
Sure. Yeah. So in PEAKPro, and you'll see when Becky goes into the system here at the next part of our training, she'll show you the actual system. There is not anything in PEAKPro that our case managers have to take action on. So you're looking in PEAKPro to gain pieces of information about whether or not your level of care has been processed or not by CBMS, and what somebody's eligibility information is. And that also is batching. There's not it's not immediate, right? Like you can't do an action in CCM and then immediately log into PEAKPro and see that would have like been acted upon.
Okay,
there's still some time
that's where I was going
to
with
wait
it.
in between them. Yeah.
Okay, thank you.
Yeah, no problem. And then I did see some other questions about like training on Streamlined and submitting certifications through CCM. And, you know, Becky mentioned earlier, we're not going to dive into Streamlined eligibility in this training, but you would have gotten Streamlined eligibility training earlier this month. We offered 6 sessions on that and the functionality in the CCM and how that operates, how that works to get your a level of care certification information into the CCM and over in through these interfaces for streamlined eligibility to occur. There were initial PEAKPro trainings that were canceled, but our streamlined eligibility trainings were not canceled. And if you need to see the recording of them or any of the slide deck, there was also an email blast sent out last week that went over a lot of FAQs on Streamlined. It was in the recording and slide deck was in the streamlined eligibility email blast, but I think it looks like we'll also put it in the chat for you guys to see. If you haven't gone to that training or seen those pieces of information, really important for you to do. I see some other questions maybe about Peak and application. Aiden, I don't know if you want to answer live, or Marianne. I can also try to speak to that too.
Hey Carly, I am trying to answer some of these. I know Marianne is as well. Is there anyone in particular that was standing out that we can address in live?
Perhaps, oh, I think it might have just disappeared on me if you guys answered it in writing. Maybe folks that don't have computers, they can't access Peak, or if there needs to be assistance with somebody's application in Peak.
For sure. And so yes, I did just answer that one. I can address it for the bigger group as well. To let everybody know, we do hear you. So if your client doesn't have a computer, but they have a smartphone, that is a way that they can access. So to let you all know, Peak is fully functional on a smartphone. If your client obviously doesn't have access to a smartphone or a computer, I know this isn't a fun answer, but I do believe that they can go into their county office and make any changes to their case and learn more about their benefits there as well.
To add to that, there are other community-based organizations that can assist over the phone. There's also the member contact center that can help with Medicaid applications over the phone. If it's well, not any other, but if it is SNAP only, then there are organizations such as Hunger Free Colorado that can do an application over the phone.
And please feel free to keep asking questions. Me and Marianne are quickly answering them via the Q&A.
Carly, are you talking? You're muted.
Thanks, Becky.
Uh-huh.
I don't see any other hands up right now, but I do see some questions in here about CCM functionality, and the streamlined interaction for the level of care versus the care plan. And so we might be able to type answers to those, but those questions should probably come to the care and case management stakeholder inbox for questions about CCM, since we're going to focus on PEAKPro today.
I do see it. Sharon Roman has a hand up.
Oh, Sharon. Sharon, if you're talking, you're on mute, but I also did, oh, I thought I saw another hand up and now it went down. Lauren. Amanda, it doesn't look like I'm able to take somebody off mute with my settings.
I'll see what I can do to make you co-host. That might have
Yeah.
to be Becky. I did open up Lauren to be able to talk if she wants to ask a question.
Thanks.
Becky, you will have to make Carly a co-host if it doesn't look like I have the ability to do that. Apologies.
I'm
And
sorry, I didn't mean to raise my hand. I do not have a question.
And I do believe I made you co-host, Carly.
There's a couple questions in there that I am unable to answer. I don't know if someone else can take a look at these.
Yeah, can we try and get Sharon to unmute, and then Donna, your question, can you please send that question to the CCM stakeholder inbox and we can address it through there, just so that we can understand what you're referencing as far as reopening and opening your care plan versus the level of care.
Can you hear me now?
Hi, Sharon.
Hi. So I deal with a lot of families of children with disabilities, ages 20 and down, from CHIRP waiver to the CES. And a lot of the issues that I'm faced with is that families do not have understanding or information on how to apply for their children's waivers or their own Medicaid for children that are IDD especially. And so when they complete an application with their income instead of with the child on their own, then they're immediately denied. And then we have a longer process to go through. Are there any specific resources that we can provide them so that, and from the beginning, so that they don't have to go through having to wait 3, 4, 5, 6 months down the line? Help? I'd really appreciate it.
Thanks, Sharon. I don't know if Marianne or Aiden have any resources about the PEAK-MA application and the specific questions that might need to go in there. That is not something that we're necessarily covering today because we're actually looking at not the PEAK system, but we're looking at the PEAKPro system, which you as a case manager will be able to access to see eligibility information about that member after they've submitted their application or maybe while the application is in process. But I do hear you about the need for resources that cover that information for your members. And it sounds like Jennifer maybe says that she might have some information to provide. Hi, Jen.
Hi. If you go to the healthfirstcolorado.com website, if you go to apply for benefits and you request the area where it asks to print or mail the application, there's a disability application on there that helps apply for the waiver program.
Yeah.
And
Thanks, Jen.
disability. You can do it on Peak, and based on what information you put in is whether it takes you to that disability portion of the application.
Yeah. All right. So I think with that, we'll probably pause our questions in the Q&A right now and coming off mute and jump back to our presentation to talk to you about what you can expect to get access to this PEAKPro system.
Thank you. All right, so in order to get into PEAKPro, you're going to have to get access to PEAKPro. So the department will be sending out, and I think I saw something that they started going out, the third-party user access request forms. So those forms will automatically be emailed to all users who are currently provisioned for CCM. These applications are going to be sent out via Adobe Sign. The PEAKPro application section is already going to be filled out. So there's only one section, section 2. It's the only thing you'll need to fill out, and that's your individual user information and your signature. And then once you sign it, then it will automatically be routed for your supervisor and security admin signatures. Once everyone at your agency, once all the appropriate signatures from your agency are completed, then the application is going to then automatically be routed back to the department for Adobe Pro for processing. Now, there may be some individuals who do not have existing CCM access, but we will need access to PEAKPro. Then the standard provisioning process will be followed. You'll complete the HCPF third-party access request form. There is a link to that in this PowerPoint. So if you don't have that, or you'll need it in the future, you can always access it from the link in the PowerPoint. Once that's completed, then it is sent to the HCPF OCL system applications email for processing. Now, once your form once your access is approved, then you will get an email from the department, and it's letting you know that your access to PEAKPro has been approved. That email is going to contain a lot of important information. It's going to contain an access, an org ID, and a passcode. There'll also be attachment to that email that will take you through the steps to self-register yourself in PEAKPro. Whoops, sorry. It's not giving me the option to do that. So the attachment will look like this. It will take you through all the steps. So when you go to the PEAK homepage, and I'll show you when I log into PEAK here in a minute. When you go to the PEAK homepage, you're going to scroll all the way to the bottom. At the bottom of the page, there is a link that says PEAKPro. When you click on PEAKPro, that link, it brings you to this page. So when you're here, then you're going to click on Create Account. Then you're going to select Request a new PEAKPro user. Then you're going to continue on. Then you're going to enter that org ID and passkey that was in the email that you got from the department. Enter that information. Then it's going to want you to verify your email address. So then you're going to enter your name and your email address. Then you're going to click on Verify Email Address. It's going to then trigger that a code be sent to your email. Then you'll go to your email. You're going to grab that code. You're going to cut and paste it into here and confirm code. The next thing you're going to do, the final step of this, is you're going to enter your first name, your middle name, your last name, along with a password. You'll want to make sure you remember that password, because that is the password you're going to use to log into PEAKPro. So you're going to submit that request and log into PEAKPro. Okay. So then you'll come here. And this is where this is going to look a little bit different for you all when you actually do it, because there's there's modernized versions. But then you'll enter your email address and the password that you created and sign in. Since for all of you, this will be your first time signing in, it's going to require you to do to create a ping ID. So the ping ID instructions are also something that is covered. There's attachment to, I'm so sorry, I'm not seeing my, just apologize. I'm going to stop sharing here for a moment. The instructions for ping ID are also going to be included in the PowerPoint. So sorry, I don't know why it's being wonky on me. Stop sharing here. I apologize. I don't know why it's giving me a hard time. All right, so to create your ping ID, so you have to do the ping ID. You'll have to do it because it's the first time you're logging in. you'll have to do it every 30 days on that same device. And anytime you log in on a different device, you will also have to do the ping ID. There's a couple of options for the ping ID. You can do it, it's going to give you all these instructions. So you can download the Ping ID app. So this document walks you through all of those steps. It take you through downloading the app, pairing your device, all of those steps. Or you can choose to receive your Ping ID via a text message or a phone call. So you would follow those steps to do it that way. Enter the code you got either over the phone or through your text message and enter it there. So those are your two options for your Ping ID. But as I mentioned, all of you will be required to do that the very first time you log in, and then every 30 days on the same device, or if you log in using a different device. I do have to apologize. I do not know why Zoom is not cooperating with me. So that is your logging in process. Now, when you're logging in, when you log in, if you're having issues, you will do not contact the help desk ticket or do not call the help desk. They will not be able to help you with your initial login. You'll need to work with your agency contact to do that. Now, please stay here with us in the training. Don't be trying to create your, the login and do your, create your, start completing your third-party form or any of that right now. You'll be getting those through email and you can do that then, but that is nothing you'll need to be doing right now. Once you get logged into PEAKPro, then you'll be navigating PEAKPro. So there's 3 things you'll be using in PEAKPro. You'll be able to view the case management inbox that is starting as of July of 2024. Then you'll effective March 1st, effective Friday, you'll be able to do the CBMS eligibility check and the long-term care level of care certification processing status. Carly mentioned it earlier, but we want to just make sure that you all understanding that PEAKPro for you right now, PEAKPro is a reference tool. It is essentially giving you access to information that you have not had in the past. So as I'm going through these screens and as I log in and start showing you them, just keep in mind, these are view, this is access information you're viewing. There is no action you need to take on anything you'll see in PEAKPro from the eligibility check or the LTC LLC processing status window. So this is the inbox. This is the referral inbox. This will be used starting in July. Once come June or as it gets closer, we will be doing training on the inbox and what you'll be doing in the inbox and be able to view and all of that. Today, we will be talking about the CBMS eligibility check window. So this CBMS eligibility check window is going to allow you to be able to view information for any individual, regardless of agency or county, that is known to CBMS. So you'll be able to view eligibility data for anyone known to CBMS, regardless of which county or agency they are affiliated with. You go in, you'll type in their name and then at least one other data point, such as a date of birth, social security number, state ID, anything like that. Then once you search, it will bring up all of the cases associated to this individual that is known to CBMS. So it's going to bring up denied cases, discontinued cases, approved cases. So it's going to show whether if they're on other programs besides medical assistance, like food stamps, adult financial. The one that we care about is going to be the medical assistance. That's the one you're going to want to look at. If you click, so then if you saw that one, you would click on the individual's name, and then it brings you to the eligibility check window with tabs that can be expanded to see all of their information. So this is what it looks like. I'm not going to get into great detail here because it'll be more beneficial when I actually log into Peak and show you what it looks like. The other window that you'll have access to is the long-term care level of care certification processing status window. So the way this window works is you as a case manager, you complete the level of care assessment in the CCM. The info from the CCM then goes to PEAKPro and then to CBMS, and then CBMS is able to update that level of care. That's in the ideal world. That is assuming that the individual is known to CBMS, has a active or pending application or case in CBMS, and then they have their financial eligibility has been approved. As we know, that's not always the scenario. So not all level of care assessments will update in CBMS automatically. There's going to be various reasons, but the nice part is you'll be able to see whether it's processed or not processed and why it was not able to update in CBMS. This is what the long-term care level of care window looks like. So you'll click on the over here on this side, click on the long-term care level care process certification processing status. It will open this window and it's going to show you all of this information. Once I log into PEAKPro, you'll be able to see how this goes all the way across and then where it shows processed and not processed and a reason. These are only some of the columns on this window, but there's a lot of valuable information on this window. So in the PowerPoint, we've included the definition of all of the columns. So the file date is the date that the file was sent through PEAKPro to CBMS. Confirmation number, that's from the number from the CCM. Then with the individual's demographic information, such as their state ID, their name, their social security number. Then their CBMS case number. And then it's going to give 3 different types of record type, like the level of care determination. So whether that's whenever the record includes a level of care determination. Any of these can also include an address change. The nursing facility is going to be set whenever the record includes an updated nursing facility info or a new level of care determination. Or the address change is whenever the record includes an address change, no new or updated level of care determination or nursing facility info. So if it was only an address change, that's what you're going to see. Then the status is either going to be processed, that was set when the member was known to CBMS, currently active or pending for medical eligibility, and has been determined and authorized. The status will be not processed if the record was sent to the inbox and couldn't be processed through authorization. And then it will give you the different reasons why it was set to non-processed, not processed. So either they're not known to CBMS, they are known to CBMS, but they're not active or pending. Maybe there was a system exception, There is a system exception, so it could not be processed and posted, or it requires a manual review. And this is going to be if there was an address change received and the CBMS worker needs to review the address and change that information manually. Okay, I'm going to pause there. And then I'm going to go now and actually log in to PEAKPro. So when I mentioned earlier, you're going to go, in order to access PEAKPro, you're going to go to the Peak homepage. When you get that email stating you've been approved and you have the instructions to go ahead and self-register, you're going to come to this page. As I mentioned earlier, you're going to scroll all the way to the bottom. You are then going to click on PEAKPro. And that will take you to the page that I showed you in that self-registration document. So you'll come in here, click create account, new user, you'll go through all of those steps. Because I am not logging into, I am logging into a test environment. I am going to come back to this page because that's how I'm going to get into my test environment to show you what you'll be seeing in PEAKPro. Also, these pop-ups I'm seeing, you will not be seeing them. I'm seeing them because I'm in a test environment. So I'm going to click on sign in. My email address and my password. Remember, this is a password that you created when you did your self-registration. Thinking, I believe. Yep. So this is the PEAKPro Case Management Agency inbox. This is the first thing you'll see when you log in. This inbox you will not be using this inbox until July 1. You will be able to see the eligibility check. So this is a CBMS eligibility check window. So this is where you will be able to see information on individuals who are known to CBMS. You'll be able to see their eligibility information. So we're going to search for a couple of different individuals. We're going to search for a client named Mac Foss. Actually, I'm going to search for the other one. Sorry, I'm going to search for Jalissa Dophelis. And once again, just to show you, if I only enter Jalissa's name and I try to search, I'm going to get an error message that I need to enter it more information. Just kind of show you what it looks like so you'll know what that message looks like. So I need additional parameters in order to search for the client. All right, then I'll go ahead and enter Jalissa's social security number. Just a reminder, this information is masked. It cannot be correlated back to any individual known to CBMS. Click on search. Just like you saw in the screenshot. So this brings up all of the cases, whether they're denied, discontinued, or approved for Jalissa that is known to CBMS. I care about the medical assistance case, so I'm going to click on Jalissa's name. And then it brings up all of these. To expand them, I just click on the plus sign. So the very first one is contact information. So this is contact information. So this is the home address, mailing address, county of residence, any phone numbers we have for this individual, and then if we have an email address. So this is the member's contact information. So perhaps if you didn't have that, you could come here and get that information. The next one we're going to look at is the eligibility info. So this is going to be the CBMS eligibility information. So it's going to give us the CBMS case number, when their redetermination is due. It's going to give us the primary medical assistance category. So it's the HCBS EBD waiver, shows that they are passing for that. Their eligibility begin date. This individual has a second MA category. It's Q and B. Their eligibility begin date there. If they had a disability diary date here, if they had disability diary date, it would show here, showing that this individual is not eligible for SSI. Then it's going to give information. This would be valuable to you if they have a period of ineligibility. It also is going to show if they're limited to EMS or RHCS. It's going to show if they have a home care allowance or a nursing facility patient payment amount. So there's a lot of great information under this eligibility info. This is information that in the past you have not had access to. Then we can click on the income info. So any income this individual has will show up here in the income tab. Once again, income that has been reported and entered into CBMS, and then it will be here. So shows that this individual's income type is Social Security disability. They receive it monthly. The amount is $526. So then their Social Security disability amount of $971.10. And it shows their totally countable gross monthly income. Then we can come look at the level of care information. So level of care decision shows that it's approved. The EBD waiver. The start date for the level of care. When the level of care will end date, and the confirmation number. That's the one that came. Okay, if they were institutionalized, it would show their long-term care institution information. This is going to show other insurance information. So if they had private health insurance, it would show that. This is showing that this individual has both Medicare Part A and Part B. The coverage begin dates. This is going to show who their CBMS eligibility worker is. So it's going to show the individual's name, the county office they're in, the address. There could also be a phone number listed here. This is going to show you their companion case information. Shows that there is a companion case and it is a closed case. So that's all the information you can see on the CBMS. Once again, there's no action you need to take on any of this information. It is just a reference tool that's going to help you, once again, kind of working with, perhaps seeing why their level of care wasn't able to process in CBMS or in anything like that. The other window you'll be looking at is the long-term care level of care certification processing status. So this is showing the information. Once again, the file date, the date came through from CCM to PEAKPro. If there's a confirmation number, then it gets once again into that individual's demographic information, such as their state ID, their name, their social security number, their CBMS case number. So this is where I talked about, this could be the address change. It could also be the different information, like if it came from the nursing facility information, or if it was a level of care determination, then it's going to show the processed. So if it's showing not processed and it's showing that these address changes require manual review, you would also perhaps see if it wasn't processed, the reason then could be perhaps that they were not known to CBMS, system exception, some of those reasons that you'll see under the reason if the status is not processed. I'm going to go back to the eligibility check, because when we looked at the last one, Jalissa, she was passing for her waiver. I'm going to go and do a search for an individual and see perhaps what it looks like if they are not passing. And then we'll pause for questions. So no matches have been found. Perhaps I have the, a wrong social security number. Perhaps there was, uh-oh, I don't know what I'm.
Hey, Becky.
Yeah.
I think she needs a last name. Yep.
She does need a last name.
Sorry, I thought it was going to work for you for a second, so I wasn't going to say anything, but.
No, thank you.
Yeah.
Could have sworn I entered it in. All right, so then here we have all the records, all the cases that are associated to Lenora Ha. Here is a medical assistance one. It shows denied of status. So then you can say, okay, this is perhaps why the level of care, hasn't went through, hasn't processed, so that I could click on Lenora's name. And then again, it's just going to show me the same information, right? So it's going to give me Lenora's address. If we have and her contact or her county of residence. We don't have a home phone number, but we do have a cell phone number and we have an email address. I want to see about her eligibility information. So her primary medical assistance category, Magi adult, shows that she is denied, and it shows that the reason that she's denied is the countable income is above the allowable limit. So you'll be able to see the reason for denial in there. Now, I want you all to keep in mind that this is a test environment. And so the test environment is going to be different. You'll be able to see, the data in the PEAK environment, in your PEAKPro environment. Just I want to let you know some things may look a little bit different. So it's, again, it shows there's no secondary medical assistance category. There is no disability diary date for this individual and not eligible for SSI. It's, again, all the same things, right? This would help you see if there was a period of ineligibility. I could open up. Does this individual have income? Yes, it shows that Lenora has earned income. She gets paid weekly. This is her income. Does she have other insurance? Lenora does not have any other insurance. Who is Lenora's CBMS eligibility worker? It's going to show me who Lenora's eligibility worker is and a phone number. So now that I've walked through those two windows in PEAKPro, I'm going to go ahead and stop sharing and go ahead and open it up to questions.
All right, I opened the chat or Q&A again. There are some questions coming in that maybe Marianne or Aiden want to answer, typing out or verbally. There are dates for denials, and it's the date of the eligibility approval denial on the eligibility check screen. I don't know if we could put that screen back up so we can just see where that field is on the eligibility check.
Hey,
A
Carly.
list of, oh, go ahead, Aiden.
You know what? You were right about to get to it. I was just going to address the acronyms question.
Yeah.
So I would like to stress to everybody on this call that we do want to make sure that for your PEAKPro usage, you're going to be focusing on MA, which stands for medical assistance. That said, this was a question we got at an earlier session of training, and I've reached out to some of our developers to get a list of acronyms. And as soon as that's available, I'll make it available to Becky and Carly, who can make it available for all of you as well. Thanks, Carly.
Yeah, thanks, Aiden. Yeah, I was gonna say the same thing. Login instructions, Erin. You should be getting an email if you're a CCM user, which I hope you are. You'll get an email with the beginning of the instructions. It'll give you a form to start signing. That'll get also signed by your agency's administrator and sent back. You'll get some other emails. So the process will start, and it'll start by you receiving an email. And you likely would not have gotten that email yet, but will be in the coming weeks as soon as we get all of the emails out to all of our many CCM users. Help desk tickets being sent, Desiree, for PEAKPro CCM errors. So there shouldn't be PEAKPro errors that maybe coincide with CCM errors, I guess, if you're thinking about like the errors that you might be seeing in CCM for service plan, care plan generation, things like that. But those won't impact PEAKPro. But yeah, all of our teams are working together. PEAKPro has its own technical assistance and help desk ticket format, where you would be using the Peak technical support, and they're going to help you with things like password resets and functionality within PEAKPro system. They're not going to be the folks that are going to help you with if I see an eligibility issue of populating in PEAKPro, or I think something might be wrong with CBMS's information. That's not what PEAKPro technical assistance will help you with. You'll need to go through your current channels for that. So it might be the CCM call center, it might be your county tech worker that you're contacting to say, I think that there might be an issue with this person's eligibility. Will provider agencies also have access to a PEAKPro system? Susan, Becky talked a little bit about this at the beginning, that PEAKPro is used by other entities in Colorado. So when you say provider agency, if your provider agency is operating as a BHA, or I think she said Department of Corrections, there's other entities that have access to PEAKPro that are entities that help assist people in the community to apply for public assistance benefits. So benefits like SNAP, is one of them. They might have access to a PEAKPro account, but in general, provider agencies that are just operating as, say, a day program or a personal care provider agency are not going to be able to access PEAKPro. The eligibility information that we're sharing with you all as case management agencies is because you are a case management agency and because you have a role to provide in this eligibility determination for long-term services and supports and long-term care Medicaid eligibility. But provider agencies shouldn't be accessing like a day program provider or a personal care provider shouldn't be accessing this level of information. Becky, will the eligibility show the multiple waivers a client was, where to go? Multiple waivers a client was active on and dates. Also, can it be possible to add the authorized rep to contact info? So the information that you're going to see in PEAKPro, Becky, for contact information is what's been put into CBMS. So either by the county worker or the member themselves through Peak. So you are not able to edit any information that's showing up in PEAKPro directly. You don't edit these screens at all and update them. The edits would have to be coming from either the county side or through the CCM with regards to the level of care information, or potentially an address change. Eligibility is not going, I don't believe where we are seeing eligibility MA category that it's going to show the specific waiver eligibility. That information really should be, you should be looking in your CCM and establishing that in CCM because we have that new universal waiver aid code. All right, I think Desiree, but actually maybe Amanda, clarification on dates for functionality. So I know that our last session, maybe not so much in the first session, but our last session, there was some pretty significant confusion about dates of implementation of all of this and how this is working because we had streamlined eligibility happen sort of in the midst of our PEAKPro training. So we have updated the information that's on our slides for that, and I think was a little bit more clear today about implementation. So the PEAKPro system right now is working for those that are getting access to it right now. We started to provide access to PEAKPro with our super user group, and then we'll be gradually getting the rest of our CCM users access to the system. We are behind schedule on that, and I apologize that we weren't able to get everyone access into the system starting 3/1. The reason that we chose 3/1 is not really that the system is getting turned on or activated on 3/1, but really because that's the date of our next case management redesign transition. And we didn't want to put folks that were going through the transition, be able to give them access with one user account set up and then have to immediately change that as of 3/1, since the timing was so close to each other. So that's really where that 3/1 date came from, for saying, hey, as of 3/1, we'll start letting you guys get access into PEAKPro and establishing your authorization for access. So I know that it did sound a little confusing last time, but streamlined eligibility, as of the initiation of that earlier this month, that's when we asked you guys to stop using your paper certifications and utilize the CCM to have that interface to send that certification information through streamlined eligibility interfaces and into the CBMS system. The access to PEAKPro doesn't change that. It just gives you a place to go and look for the eligibility information and whether or not your level of care has been processed. So again, I do understand it's a little frustrating to say, hey, we're not getting access until after 3/1 for our entire agency, but you will get it, and it doesn't impact streamlined eligibility interfaces that are already occurring as of today. Eligibility statuses can be received and understood through the CCM, and we went over some of that in the streamlined eligibility training and the tasks that a case manager will receive when the LOC information is received by CBMS and eligibility information is changed. A case manager will receive a task. You'll be able to see information on your health coverage card in the CCM as well. Not as detailed as all of this information, but you will be able to see that eligibility change. Kelly asking about a financial grace period. I think you might be talking about a period of ineligibility. And I haven't heard of it as a financial grace period, so maybe that might be something different. But if you would like to come off mute, let me know to clarify. But you will see down here at the bottom of the screen, Becky, showing active POI. That's the period of ineligibility. It would show you that information. Let's see. Becky, do we have any hands up? I'm gonna kind of go back and forth between hands and.
Let me see here. Let's see.
While you're looking, if you can take anyone who's got their hand up off mute, I will try to answer a couple other questions. You know, if it's rolled out Friday, meaning you're going to be able to start accessing on Friday, why aren't we getting login emails for a few weeks? And again, Ariana and folks on the call, we're behind on the provisioning process to get everybody the provisioned and eligible for access into PEAKPro, and we started with our super user group. So some folks at your agency probably are getting access. They would have gotten those emails last week to start getting them in. And then we're following it up with getting all the rest of our CCM users access. It's just not a hugely quick process. We've got over 1,200 CCM users, and so we're having to generate all of those access request documents for you guys to get and sign and start getting into the system. Let's see. Did we have any hands up, Becky?
You know, it looks, but I'm not seeing a name associated to it. So,
Looks like Tim, I think, had his hand up.
okay.
Asked. Tim, are you there?
That was an accident. My apologies.
Okay, we'll let it slide. Let's see. Mark Smith says a situation might cause someone to complete 2 or 3 days or even 1 day before HCBS certification period ends, and you get the 100.2 and service plan completed. Will there still be a lapse in coverage? How soon to the end date would create a lapse? So, Mark, that's really going to depend on what is happening with that member's financial eligibility situation. Case management best practices is to be doing your continued stay reviews 60 to 90 days ahead of time. So waiting until the last day of their certification period could be problematic to get the response back from the county through CBMS about their financial eligibility. So it's hard to answer that question about how soon could create a lapse, because it's really dependent on what's happening with that member's financial eligibility situation, which is why we try to get those level of care over to the county and processed through the CCM a lot sooner than that close to the end date. So Abby, you no longer need to send your LOC certifications to the county as of the initiation of streamlined eligibility, which happened earlier this month. And we had those trainings earlier this month as well. So you should not be manually sending your level of care certifications to the county. That information is being processed from the CCM into CBMS through the streamlined eligibility interfaces. Let's see. Delaney, I think this is the place to ask your question, Delaney. She's asking, for those of you that are on the phone or can't see the chat, how is PEAKPro going to reduce the backlog of financial and certification paperwork processing resulting in eligibility breaks that are happening at the county? So it's not necessarily just PEAKPro that's being implemented that's supposed to start working to reduce that. It is a combination of PEAKPro and the larger streamlined eligibility process that we've implemented through the care and case management system and the Colorado benefits management system, all being able to talk to each other. The way that we're looking at this reducing some of that backlog is in a couple of different ways. So information is processed more quickly and more efficiently. When a case manager puts their level of care certification information into the care and case management system, it's going to process through a data exchange overnight into the CBMS system. So what we've done by allowing that communication between the systems to happen is reduced the manual work that can cause delays between the county and the case management agency. So Becky went over this a little bit at the beginning of the training, but what used to happen is you had to print your certification pages, maybe PDF them, print, fax them, maybe email them, or walk them across the hall, put them in somebody's, to-do list, and then they'd have to manually also get processed and that information manually put into the CBMS system by a county tech worker. Lots of room for human error in that process. Lots of room for delays, lots of room for lost certification pages that maybe didn't go through in a fax or didn't go through in an email. And hopefully what we see happening with this interaction between the systems is that gets reduced. The amount of manual time that is needed to do those tasks is reduced because the systems are talking to each other now and receiving that information. Another way too is by you all being able to access PEAKPro and see this eligibility information, you're not waiting perhaps to say, oh, I need to know somebody's income. Okay, now I have to generate a case management agency eligibility information sharing form and send it to my county tech worker and ask them for the financial information and then wait for them to respond back to me. And that goes into a fax queue at my case management agency, and somebody has to process it and then send it to me. That could take weeks or so, potentially, to get that information. And now you'll be able to log into PEAKPro and see that financial information that you're looking for. So I hope that answers your question, Delaney, and some other folks on the line about really why we're doing this and why we're having you access the system and go through Streamlined. Anna is asking, can you communicate with the county worker through PEAKPro? No, you can't do active communication through PEAKPro, meaning you can't type anything out in PEAKPro and have it be sent to your county. What is getting communicated is your level of care certification information from the CCM, and then the information that the county CBMS worker is putting into CBMS is also going to show up here in PEAKPro. But there's not an active narrative communication that you can do through PEAKPro. That being said, you are still allowed to communicate with your county workers, right? You can still use that information sharing form to ask your county worker anything you need to about the case that you're not able to gather information through PEAKPro on. Or that you need to let them know of. I know sometimes case managers get informed of maybe trust information or changes in income, and you want to be, letting your county workers know ahead of time or as soon as you get informed of that, rather than waiting for the member to disclose that information. And so you can send whatever you need to through the information sharing form still. As far as information gathering, please do not send certification pages to the county tech workers anymore, though. We need to let the streamlined eligibility interface do that in CCM. All right. I don't see other hands up or questions coming into the chat. So if we want to switch back over, Becky, I think there's a couple more slides on some resources and the information on help desk tickets that we'll share with you all. So when you do get access to the system, you'll know what to do in a situation where you might need to contact the help desk.
All right. Perfect. Oh, that was weird. All right, so as I mentioned earlier, you'll have access to this PowerPoint once we decide which recording to keep and we have everything all fine-tuned. So this PowerPoint and the recording, plus additional like a desk aid, FAQ, the help desk ticket template that you'll need to use when submitting help desk tickets, that third-party user system user access request form that I mentioned, that if you are if you're not automatically going to get the information because you're provisioned in the CCM already. And then the steps to do that PEAKPro ping ID that you'll need to do the first time you log in, every 30 days on the same device, and anytime you log in on a different device. So these are links to those documents. And speaking of help desk ticket template, let's talk about what the help desk can do for you. So the Peak help desk can help you, once again, reset passwords, help you with any error messages perhaps that you're getting in PEAKPro. Maybe you locked yourself out. You thought for sure you knew what your password is. You tried it too many times and then it locked you out. You can call the help desk. They can help you get unlocked. Or for the ping ID, not your first ping ID or not your first login, but for your ping ID, if you lost your phone, forgot phone, or removal of device, things like that. They want you to go through a few steps before you submit a help desk ticket. So, every agency will have an organization contact. So if you're having issues in PEAKPro, first thing you need to do is work with your organization contact. you and the organization contact can work through and determine if it's a technical issue, or perhaps maybe there was misunderstanding of what you were supposed to be able to do or see in PEAKPro. If it does appear to be a PEAKPro technical issue, then what you'll need to do is you'll need to go to the help desk ticket template. To get into two places in this PowerPoint. You'll open it up and you'll gather all the information that you can. And we want to make sure you have case number, individuals' names, any information that you can put on the help desk ticket template before you call them. That way, when you're on the phone with them, you are not scurrying to try and find the information. You have it all right there in front of you, so they can start evaluating and seeing what the issue is. If it is determined while you're on the phone with them that a help desk ticket does need to be submitted, then you would want to make sure you add any additional information that you discovered or that they asked you to enter onto that template. Make sure you take screenshots and include the case number of the case you're working on. If you submit a help desk ticket without screenshots or without a case number, your help desk ticket will be returned until they have the information that they need. So those are the steps for the help desk ticket. Do we have any questions with any of that? All right. So the key takeaways, as we've mentioned, PEAKPro launches March 1st. Just a reminder, there is nothing you'll need to do on the windows that you'll have access to once you get into PEAKPro. As Carly said, it's going to take a while to get all the individuals that need access to PEAKPro, getting them access. But you'll just be reviewing that information as a reference. At this point, it is not being used for the receipt of referrals. That will happen in July. What do you need to do now is once you get the email, then you'll need to start taking action to complete the form, get the appropriate signatures on, get it submitted. Once you get the email back stating your access has been approved, you'll want to make sure you do that PEAKPro self-registration. And one thing I did forget to mention back when I was talking about it on that slide is you go in, you'll do that PEAKPro self-registration. You're going to enter the org ID and the passcode, create your password. As soon as you've completed all those steps for self-registration, you'll want to make sure you reply to that email and let them know that you have completed self-registration. Making sure that you complete all those steps will make it just smoother for everybody working on granting access and requesting access. Once you get access, get in there and explore the system, and you'll have the ability to check a member's eligibility at any time or when prompted by the CCM. That is all of the presentation I have for everyone today. I'm not sure if we have additional questions coming in, or if Carly, Aiden, anybody likes to chime in on something, perhaps clarification of something I mentioned, or maybe add something that perhaps might be beneficial.
I do have the Q&A open again if there's any pending questions to type. Looking to see if there's any hands up. Okay. I do want to mention I was just kind of working in the background here a little bit for you all, and I have some confirmation that they are working on doing application emails to get them out to the rest of our CCM users today, this afternoon. They're going to start doing some additional ones outside of super users, and then they're going to be doing a lot tomorrow as well. So hold tight. I know it can be a little tricky to not have access to the system that we're looking at here today, but I hope that, you know, this gave you a good overview of it. And by Friday, many of you will have received those emails, if not, you know, the following week. So it shouldn't be too much longer till you're able to jump in and get into this system and see the information for your members. So again, you know, I know that's a little tricky for you, and I appreciate your patience while we're getting all of the many users the documents that they need to get access to the system.
Carly Veronica Myers has her hand raised, so
Yeah, Veronica.
did you mean to have your?
No, sorry.
No worries, no worries. I saw it go down really quick.
Yeah. The also I want to just say for Corinne, who the ray is for a person, that information is also in the CCM. When you look at the care team, I believe it's going to be populated in there. And forgive me if I'm saying the wrong space. I think Lydia might still be on here, but you should be able to see that information in the CCM. But a member could also look and see who their ray is if they had that Health First Colorado app. So the member could get that information in addition to the case manager. Let's see, can you, Derek's asking, can we elaborate a little bit more on a scenario where the CCM would prompt you to go to PEAKPro? Yeah, you're gonna get eligibility tasks, and I see Lydia's typing an answer for you too, but you're going to get eligibility tasks that say a member's eligibility has changed, verify. You can go to their health coverage card to look and see what's there, but then you can also come into PEAKPro and see what's on their eligibility card. Another task that you might, and I might be not using the right word if it's task or notification, that you receive will be when you complete your level of care. It'll say, you know, member met level of care, continue with assessments, but you can go into PEAKPro and look to see at that level of care processing status page to say, did my level of care, I put all my information into CCM the correct way, and it transmitted over to CBMS to be processed. And Lydia, you can come off mute too and elaborate on that if I missed something.
Hey everyone. I am still typing the answer to Derek, so I want to make sure I go back and finish that. But the two tasks Carly mentioned are really the two tasks case managers will see for members when there's a need to perhaps look at PEAKPro or reach out to the county about eligibility questions for financial eligibility. And then as Carly was mentioning, you'll know that their financial eligibility has been approved, and you can move on with the process when you get a task that says pending assessments. Assessments mean that that member is now ready to move on with the care plan and service planning process. And so that's also a way for you to know that that member has been financially approved. And all of those key points or that information you're getting from PEAKPro, you can also look at in CCM in that health coverage section. So that's a great area for you to look at when you have some questions about their eligibility.
Thanks, Lydia. Another question about the Medicaid disability application, Elizabeth's asking, and Becky, I don't know if we can go back to the eligibility screen again, but that screen does have the information about the disability determination diary dates, I think is what it is, the field is titled. And you'll be able to look there, disability diary date. But I think this was answered too by Aiden earlier. The Medicaid disability application is not something that is completed through PEAK for a member. That's separate and aside. So you're not going to be able to see like the processing status of that application. But it would, maybe Aiden or Marianne can jump in. I don't know if there's a section here that shows the like approval of it, or is it just the date?
I believe it's just the date.
Yeah. So you might have to still be, this might be one of the things that you're still communicating with your county partners through that information sharing form. If you've been waiting for something, you think, or your member is telling you that it's submitted, and there maybe are delays, that would be a time where you would still need to have that communication with your county. Okay.
Stephanie Schmidt has raised her hand, so let me. Oh. Looks like her's backed out, so that might have been an accident. Oh, no.
Stephanie.
All right,
Hi,
Steph.
can you hear me?
Hi, we can hear you now.
Quick question. Will we have information if they are missing like specific like resource information or anything like that? Will it tell us like specifics on that if they have something turned in partially but they're still missing something?
So I know Aiden and Marianne might be able to comment on this more, but this reason field that you see on here is going to show like why they were denied. No, I don't think that it shows you on this eligibility screen like what is pending from them without like they've made the decision to deny them. There are other reasons that show up on the LOC processing status page where it'll say, I think that's on the LOC processing status page where it's saying like that the member is known or not known to CBMS, and that's why something couldn't be processed. Where that might indicate that they need to submit an initial application because they haven't done that. That person's not known. That's
So if there is anything pending,
Love you.
the client will need to go into their own Peak account and they can see what's pending on their dashboard. So at this time, you'll only have access to the eligibility check and won't be able to link a case. Unfortunately, you will have to guide or direct the client how to create their own Peak account or go on their app on their phone, and then they can view what pending documents are available to them or requested of them.
Yeah, and so that's where I think the information that besides this eligibility begin date, eligibility end date, status is if your agency has completed your level of care, then you would be looking on that level of care certification processing status page, And you might see one of those reasons that says, hey, this person is known to CBMS, but they're not active and they're not pending because the CBMS tech county worker needs to manually enter data, or the member might still need to submit their application. Maybe this is more applicable to an initial assessment that you're doing. But you'll see those statuses to say like, it's not going through, there's a holdup, right? And it might be because they're missing an application, or they're not known to CBMS, and you might need to work with the member to say, hey, contact your county. If you don't have a PEAK account and you don't want to set up a PEAK account, that's okay. But you need to contact your county DHS office directly and figure out what it is that they're missing, so you can work with them to get the information that they need. Or, oh, you do have a PEAK account, you should be able to go in there and see that information on your end as the member. All right. Not seeing anything else come in. You know, I again appreciate you guys taking the time out of your day to spend with us and learn about this PEAKPro system. And we can look forward to getting you guys access here in the next couple of days, next week, and being able to provide you the recording of this training, the slide deck, and an FAQ to help answer your questions as you go through accessing the system, and seeing how it interacts with streamlined eligibility in your CCM. And hopefully it's going to be able to make your lives a little bit easier as you're working through your cases. If you need to, go ahead and reach out with questions, comments, concerns. We'll try to get back answers to you as we can. And I think that's it, but Becky, I can let you close out.
Yeah, I got just checked for any hands up. I don't see any hands up, so I think we are good to go ahead and close out. Like Carly said, thank you for joining us, and we'll get all this information posted to the LTSS training page. So thank you, everyone. Have a great day.
Thanks, guys.